Good morning. In this presentation, we're going to talk about trigeminal neuralgia in pregnancy patients, a case report. Trigeminal neuralgia is defined as those sudden, severe, brief, and recurrent episodes of pain in the distribution of one or more branches of the trigeminal nerve. Its prevalence is 0.16 to 0.3% and is more frequently found in women. However, there's only one case reported in the literature of trigeminal neuralgia in pregnancy, and the main problem in those patients is the management, because it implies important further risks. As we can see, there are two main management groups, the pharmacological and the invasive. Nevertheless, main pharmacological treatments are associated with fetal risks. For example, anticonvulsants are associated with higher risk of malformation. In the same way, invasive management is limited. Gamma knife radiosurgery, for example, requires 6 to 8 weeks to pain relief, and microsurgical decompression implies anesthetic and surgical risk for the mother and for the fetus. The main object of this case is to assess effectiveness of radiofrequency ablation of Caesarean ganglion in pregnancy women with trigeminal neuralgia. In the present case, we present a 31-year-old woman on the 17th week of pregnancy with trigeminal neuralgia since 3 years ago. She consults the emergency department because 2 weeks of high-intensity fascial pain extending from left preauricular area to the ipsilateral mandibular region that worsens when she talks, eats, and touches her face. She was previously well controlled with carbamazepine. Nevertheless, medication was changed to paracetamol since pregnancy. Physical examination revealed severe pain with touching left mandibular region. We decided to perform an initial pain assessment. We used the Brief Pain Inventory Facial Scale, which is a multidimensional pain scale that measures 3 domains of pain. First, pain intensity, that was 10. Second, the general interference with activities of daily living, for example, working, walking, relations with other people, or sleep. In this case was 9. And finally, facial interference with face-specific activities, for example, talking, smiling, or eating. In this case was 10. Because of high intensity of pain, we decided to perform radiofrequency ablation of Caesarean ganglion. In the operation room, patient's abdomen and chest were covered with 2 folds of lead aprons to prevent fetal exposure to radiation, as we can see in the picture. Then Harley's technique was performed, and the total radiation exposure was close to 60 milligray. After the procedure, patient reported an important reduction in the pain. Then she was discharged with paracetamol, and 1 month follow-up we decided to perform a new pain assessment, which is this one. Using the same scale, the improvement was 90% in pain intensity, 80% in general interference, and 80% in facial interference, showing good outcomes. Then echographic fetal controls didn't show any fetal alteration. Well, to our knowledge, there is just one case report in the English language literature that describes trigeminal neuralgia in pregnancy patients. They also used radiofrequency ablation of Caesarean ganglion and showed good outcomes too. It is demonstrated that the most critical phase in fetal development affected by radiation is the organogenesis phase, which comprises 4 to 10 weeks of gestation. Also, the CDC recommendations indicate that radiation dose above 100 mg produce fetal consequence. Below 50 is safe dose, and between 50 and 100 represents a gray or inconclusive interval. In our case, we use 60 mg. However, we should follow those recommendations. As conclusions, trigeminal neuralgia in pregnancy is a rare condition and implies important management restrictions. Also in pregnancy patients, pharmacotherapy and invasive management produce severe adverse effects in the fetus, limiting its use. Radiofrequency ablation of Caesarean ganglion is a safe, coherent, and effective intervention in pregnancy patients when it is performed with preventive measurements and limiting radiation exposure. For example, using less than 50 mg exposure dose, use folds of lead aprons, and understanding the organogenesis as the most critical fetal phase. Thank you for your attention.